Trigger warning on this video, I'm going to talk about preeclampsia or gestational or chronic hypertension within your pregnancy, so that's high blood pressure in your pregnancy, and what the long-term risks are for women after that pregnancy has ended. Preeclampsia Foundation recommend that any woman who has had high blood pressure in the pregnancy should have an annual check with your GP or doctor every year, checking your weight, your blood pressure, your blood sugar and your cholesterol, so that way it helps to detect early any signs of long-term chronic hypertension. And the NICE guidelines clearly highlight the future risks for women. For women who've got gestational hypertension, so that's pregnancy-induced hypertension, they have a 2 to 4-fold increased risk of hypertension in the future, a possible increased chance of stroke, and a 1.5 to 3-fold increased chance of cardiovascular disease, and a 1.5 to 3-fold increase of future major cardiovascular events, so that's like heart problems. For women with preeclampsia, they have a 2 to 5-fold increased chance of hypertension, so high blood pressure in the future, a 2 to 3-fold increased chance of stroke in the future, around a 2-fold increased chance of having a cardiovascular event and causing mortality, a 1.5 to 3-fold increased chance of any sort of future cardiac event. Women who develop preeclampsia before 37 weeks are at greater chance of this, and there is also a correlation. The worse that the blood pressure was, the more medication that a woman needed, the higher the chance of these above risks. There is also an increased chance of kidney disease as well from having had preeclampsia in your pregnancy. And so it's important to mention this at your 6-week check with your GP, and they should recommend an annual GP check, an annual doctor check, where you get all of those things checked over. Because again, early detection can lead to earlier treatment, which can hopefully reduce the risk of things like the stroke, of the cardiac problems, of the hypertension as well. So that early treatment and early diagnosis through going to see your GP on an annual basis for those blood pressure checks. And all women who develop preeclampsia, gestational hypertension or chronic hypertension should be advised to do this as part of their care during pregnancy by their midwives, by their doctors, and then seeking that through their GP.